It is my great honor to welcome Professor Michael Frass, Professor Emeritus of Medicine at the Medical University of Vienna, renowned for his leadership in clinical oncology and integrative cancer care, Chair of WHC and President of the Austrian Umbrella Association for Medical Holistic Medicine. Please welcome.
Thank you so much. Allow me to talk a little bit about the periodic fever syndrome, or called PFAPA. And now we will also put it onto the screen. Thank you so much. It's periodic fever, high fever lasting for a few days. It may be accompanied by aphthous stomatitis, by pharyngitis, including tonsillitis, and or also cervical enlarged lymph nodes. So this syndrome has been described many years ago. The fever may last for about 3 to 6 days, and an average sometimes maybe also 8 days. And it recurs at a nearly predictable rate at around 3 to 8 weeks. So if you imagine every 3 weeks your child is ill for 4 or 5 days, you may lose your job. And the signature symptoms are, as already prescribed, periodic fever, aphthous stomatitis, pharyngitis, and or cervical adenitis. The prevalence is increasing. The number of treatment choices has grown, but data from clinical trials are limited to small cohorts. The response to a single dose of corticosteroids is striking. However, parents often report that the intervals reduce. So instead of, for example, 5 weeks, every 5 weeks, it may now be every 3 weeks. And in addition, many parents don't like it that their children at an age of 1 to 3, 4, 5 years are already consuming corticosteroids. The background is that it was first described some decades ago, and it's probably the most frequent non-infectious disease, recurrent disease found in children. And this disease usually starts before the age of 5 years, but it may be also later, of course, and it generally resolves by adolescence. But it may last for many, many years. I know children who have this symptom for about 10 years. The patients are usually asymptomatic between the episodes. They show a normal growth, a normal development, and it may be an acquired autoimmune inflammatory disorder recurring without clinical signs related to upper airway respiratory disease or other localized infections. The disease usually has a rather benign course. It might relapse during adulthood after a spontaneous or treatment-induced resolution in childhood, which has been described in 2017. The presence of variants in inflammatory inflammasome-related genes, mostly in MEFV, suggests a possible role of these genes in PFAPA pathogenesis. Now, this is a diagnosis as described by Rigante in 2017. Children are suffering from regularly recurring fevers with an early age of onset, more or less 5 years of age. And the symptoms are occurring in the absence of respiratory infections with at least one of the following signs: aphthous stomatitis, pharyngitis, and or cervical lymph adenitis. But some of the children experience all of this clinical signs. A cyclic neutropenia should be excluded. It should be completely asymptomatic between these episodes, so there should be no bowel problems and no skin symptoms and no rheumatic diseases. And the children show normal growth and development. The treatment choices are, as already prescribed, cortisone, but this is something which many parents don't really like, and tonsillectomy may be another choice. However, many pediatricians, rheumatologists, and otorhinologists, they said they're not convinced of this way of treating PFAPA. I have treated about sorry. What was the right? Yeah? Okay. Okay, sorry. So far, I have treated about 30 children, and all but 3 have reacted positively to individualized homeopathy. Some of these children react immediately, or some of them within a relatively short period of time, up to about half a year. Once in a while, a family was coming, and the father of the child, he was very skeptic about homeopathy, as it is usually in human males. And at the end of the treatment, of the anamnesis, of the history taking of his daughter, he said, I'm suffering from a special type of alopecia, and can I do something? I said, okay, we can try acetum hydrofluoricum, and maybe it helps. If it helps, it's good. If not, we have to make a special analysis with you. Next time, when this family came again, the child was completely healthy after one single treatment, and also this folding of hair has disappeared. So now he was convinced. This is the usual way that male come into contact with homeopathy. They have to see it first. They cannot imagine. That's the difference between males and females. At the anamnesis, this boy was 4 years and 6 months old, and because of a polycystic ovary syndrome of the mother, an in vitro fertilization was performed. It was a difficult labor. The boy faced his face up, so-called stargazer, and therefore a cesarean section had to be performed. And the mother suffered from postpartum depression. Usually in homeopathy, pulsatilla or lachesis may be a very important remedy in these cases. The child was breastfed for a year with extreme digestive problems, with alternating diarrhea and constipation, and the parents divorced in October 2018. Now, the boy is regarded to be highly sensitive. He speaks very well and intelligent. Before he suffers from something else, what can happen then? So he's very cautious. And he's shy, reserved. He's not a daredevil. And half a year ago, the boy suffered from mononucleosis. His right side was swollen together with axillary inguinal lymph nodes on both sides. And in addition, he was suffering from splenomegaly. Now, another homeopath had treated the boy by help of lycopodium. You know, lycopodium is more on the right side, and it also helps to decrease swellings on the right side of the neck. Now, this PFAPA disease appeared at the age of 12 months. It occurred every 5 to 6 weeks with a fever up to 41 degrees of Celsius for 1 week. Antibiotics don't help very much, as well as antibiotics also don't help. And of course, in my eyes, antibiotics are not very useful. PFAPA was diagnosed by a pediatrician, and almost for 4 years this problem lasted. And then for another 8 months, the fever occurred now every 3 weeks, not 5 to 6, but every 3 weeks. He sleeps a lot, he's very calm, up to 40 degrees. He's not in a bad mood. He's not aggressive. And the beginning and end takes place very quickly. In case of fever, the patient has a red face, sore throat, and swollen cervical lymph nodes on the left side. Now, there's no sensitivity to light or noise, as it is usual with belladonna. Now and then he's suffering from headaches. He has warm hands, but no after ulcers. And 2 weeks ago, the patient had 41 degrees of Celsius for 6 days while on vacation in Italy. He was treated with cortisone, and fever disappeared for 1 day, and vomiting occurred the next day, which he never had before. And now, opposite to the materia medica, I prescribe belladonna CH200 once a week for 4 weeks, with the rapid and sudden end of the fever and the red face being the decisive factors to decide for this homeopathic medicinal product. In English, you know, it's homeopathic medicinal products. And because of the high sensitiveness and the grief after the divorce of the parents, I gave him natrium muriaticum. It may also be called natrium chloratum, more or less the salt you're eating every day, in an LM6 5 globules daily for 3 weeks. After a follow-up, after 6 months, the mother reported that the boy has been completely healthy since this time. There were no more fever attacks since the first treatment. And since I would like to make a study, but it is extremely difficult to find colleagues to cooperate, and it's also very difficult to get the money together for a real comparative study. I just published this retrospective case series. I published the history and symptoms from 10 out of 13 children, who were consecutively treated because of PFAPA symptom. Mean age was 3.5 years. The clinical outcome was assessed using the modified Naranjo criteria for homeopathic causal attribution inventory. And if you have more than 8 points, then there's a presumable correlation between homeopathic therapy and improved symptoms or cure. And I used homeopathy in a classical way using individualized prescribing. 9 out of 10 children recovered within 1 to 5 months of treatment. The median follow-up was about 36 months. And mostly I used Atropa belladonna, calcium carbonicum, mercurus solubilis, phosphor, and pulsatilla pratensis. So, in my eyes, there was a time-dependent improvement with regard to frequency of flares, as well as of the intensity of symptoms, up to a complete disappearance of disease. Some parents also reported there was, besides the physical improvement, there was also, in addition, a developmental behavioral leap. So in conclusion, this case series suggests that individualized homeopathy is a potential therapy option in patients with PFAPA. If you understand German, we would like to translate it into English. You could buy this book. It's very big, so in case you don't read it, you can also use it in a cold winter for heating. And I want to thank you for your attention. I hope this is the correct translation. And many years ago, I was here with Professor Dr. Pavel Dyszyński, who has worked in my intensive care unit about 34 years ago. Thank you so much for your attention.